Okay, next is Dr. Nandhini P. Das, free paper 16.
Good afternoon. I am here to present my study topic on the utility of cerebral visual impairment inventory in screening among children attending Regional Early Intervention Center in a tertiary care center. So the term cerebral visual impairment implies that the site of visual impairment is present in the parts of the brain that process the visual information. The damage to the dorsal and ventral stream is responsible for the clinical features of CVI. So it is a spectrum ranging from low function CVI to the high function CVI. So the recent trends has shown that increased survival of high risk newborn has increased the risk of CVI along with other neurodevelopmental conditions. It is one of the emerging causes of visual impairment in India. It is underdiagnosed and underreported in India. So we must be equipped to manage these children. A structured screening questionnaire relating to child visual function help in eliciting the signs and symptoms and is cost effective for screening larger group at risk. No validated instrument for screening is available locally. The objective of my study is to assess the effectiveness of CVI questionnaire based upon the Dutton Insight Inventory for early screening and compare with clinical examination. Also to study the common neurodevelopmental condition associated with CVI. The study design used is a diagnostic test evaluation conducted at REIC Department of Ophthalmology, Government Medical College, Thrissur. The population include all children of neurodevelopmental condition referring to the REIC and attending the CVI clinic for a period of 1 year. The inclusion criteria, the child aged from 4 to 15 years with neurodevelopmental condition and no obvious visually accountable ocular pathology. Children who had previously received advice on specific habitational strategies, parents not willing to give the consent were excluded from my study. The sample size was 100. This was calculated from the sensitivity of CVI by the Aishwarya et al. Study with 95% confidence. Study procedure. After taking the informed consent, the following demographic details like age, sex, associated neurodevelopmental condition or any radiological investigations were noted. Followed which a translated and a validated version of Dutton's Insight Inventory containing 51 questions were given to the parents for the screening of the children, and then these children underwent a detailed ophthalmological evaluation and special test for CVI. The study tool includes a translated and validated version of Dutton Insight Inventory in Malayalam. So each question is rated on a 5-point scale ranging from 0 to 5, that 0 means never, 4 is always and 5 is not applicable, and mean scores were calculated. A positive result on 3 or more questions is considered positive for screening of CVI, and these were clinically correlated. A comprehensive ocular examination is done including the fundus examination and dynamic retinoscopy. And this is the CVI clinic of our department, and these are the tools we used in our clinic. And the special test for CVI include the LIA mailbox and LIA 3D puzzle. The diagnostic criteria for CVI is visual loss not explained by the ocular examination or having any associated neurodevelopmental condition or presence of a unique visual and behavioral characteristics. How we diagnosed is that presence of one of the unique or visual behavioral characteristic along the other one of the two diagnostic criteria which I mentioned earlier. So these are the 10 characteristics of CVI, and these are the two examples like glide gazing and difficulty near vision. And to obtain the cutoff value for the Dutton Insight Inventory for predicting CVI, the following parameters were calculated and were clinically correlated. Coming to the result, out of 100 children with neurodevelopmental condition, 59 were diagnosed to have CVI, and among that, low function CVI was 39, which is profound CVI, and high function CVI was 20. The distribution of participants based upon the diagnosis of CVI by Insight Inventory, if they scored 4, that is always in 3 or more questions, 21 were diagnosed with CVI, and clinically 59 were diagnosed to have CVI. So this is a distribution based upon the special characteristics, and diagnostic accuracy of the Insight Inventory were calculated by using a 2x2 table. We calculated the sensitivity, which was 33.9%, and overall diagnostic accuracy was 16.4%. The most common neurodevelopmental condition was hypoxic ischemic encephalopathy. So in this study, I present the evidence of predictive value of the CVI questionnaire. So comparison with similar studies is, in my study the sensitivity was 33.90% compared with that of the Aishwarya et al. And E. Orbiter study, which was much less. The probable reason of low sensitivity of the questionnaire may be large number of the children of my study group was low function CVI in whom the responses were not applicable, or maybe the prospective nature of the study. Coming to the conclusion, in this study, the CVI questionnaire was not found to be much effective as a screening tool due to low sensitivity in our study population. Larger trials may be required for further validation of the CVI questionnaire. And the most common neurodevelopmental condition was hypoxic ischemic encephalopathy. The limitation of study, majority of the children were low function CVI, which was profound CVI, and limited sample size and limited duration of the study. So I would like to conclude by saying that early screening and intervention of the CVA may improve the visual outcome of these children. So a valid screening tool is helpful for them. Thank you.
What is CVI?
Sir, it's a cerebral visual impairment.
Have you mentioned the expansion in any of your slides?
Sir, in the first title page only I have.
And
in the
can you put the
introduction
slides,
also.
please? Or on the slide. What is CVI?
Cerebral visual impairment.
That's what?
So in the introduction slide I have
Yeah.
mentioned
In the first slide.
form.
Can you go move the slide to, you said some tests are being done in our clinic. Go ahead. Okay. Next. Oh, go back. All the four. No. Next one.
Back.
No, the four slides you showed. No, that one. Next one. All are taken in your clinic only.
Yeah, yes, sir.
Okay.
Thank you, sir.